Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight we're going to talk new treatment for prostate enlargement in men. We're also going to look at vaping risk in kids. And you want to avoid food poisoning at Thanksgiving, we're going to talk food safety. All that and God's Pantry is here. But to start us off, my first guest tonight is Dr. Amul Bhalodi, and you are a urologist with Baptist Health.
Yes, sir.
Well, thank you for coming in. And the deal is, I guess if men live long enough, eventually we're going to have some prostate enlargement, and it may or may not be a problem. Tell us what some symptoms that we might need to look for.
Thank you for having me. Some of the symptoms that men tend to have are weak stream, waking up at night, 2 to 3 times, hesitancy, or it may take a minute or two to get started, and even up to incontinence or leaking urine.
Well, give us a little anatomy. Why is it that creates a problem? That you can't empty your bladder, or tell us why prostate enlargement does that?
Well, I tell patients all the time, this is plumbing. You have a pump, which is your bladder, and your urethra, which is a pipe that empties urine. And your prostate is situated right around that urethra. And so as we age and your prostate grows, it can cause a blockage or a clog. Is
there a risk other than getting old?
No, as all men age, their prostates will grow. For some men, it bothers them, and for others, it doesn't cause any problem.
Okay. Now, you say bother them. Is there a time when you need to see the doctor or consider treatment?
Yeah, the number one thing is if your symptoms become bothersome to you. If waking up at night 2 to 3 times is affecting your sleep and your quality of life, then see your doctor or talk to your primary care physician for a referral. If you notice that you're having to go very frequently, if your stream is very weak, and this is affecting, again, your quality of life, then it's time to see your physician.
Now, the treatment options, anywhere from diet all the way to surgery. Tell us a little bit about the gamut and what some things you can do.
Sure. Well, number one, you can do nothing, and it may get worse. Medical management is an option, where we would give you medication to kind of relieve your symptoms, and finally surgery.
Now, and I've heard some people say caffeine or alcohol might make it worse. Is there other dietary things that make it worse? And is there any over-the-counter medicines that you see on TV? Does it really make a difference?
For some men, the over-the-counter medications may help. Things that make your symptoms worse, you mentioned alcohol and caffeine. A lot of sodas have quite a bit of caffeine, which people don't realize. Spicy or acidic foods may worsen your symptoms, and anything that can bother or irritate the lining of the bladder may worsen your symptoms.
Now, there's new treatment out, and you're doing one specifically, and I don't know if I'm going to get this right. It's called hydroablation. Is that correct?
Aquablation.
Aquablation.
Yes,
Close, aqua and hydra.
Yeah, that's right.
Tell us about that.
So aquablation is a newer technique. It combines ultrasound and robotically guided resection of the prostate. And so we are able to use that ultrasound to map exactly what portions of the prostate we want to remove. And that enables us to avoid complications.
Is it a hospital procedure, outpatient? What kind of recovery?
It is a hospital procedure. Typically, men stay in the hospital overnight. You would have a catheter in place for approximately 3 days. And then once the catheter is out, your symptom relief should be pretty immediate.
So what's the difference between aquablation and surgical ablation?
Both are, the idea for both of them is to remove the part of the prostate that's causing you a problem. The advantage with aquablation is that we don't use any heat, does not require any incisions. There's no, we can go through the urethra, and so there's no incision in your abdomen. We sometimes choose to use cautery if there's any bleeding afterwards, but the resection itself is done without any heat.
Well, we appreciate you coming in and thank you for the care that you give your patients.
Oh, I appreciate you having me here.
And if you're having symptoms that are bothersome, see your primary care or urologist for help. We'll be right back.